Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by Nancy Sayegh-Rooney, who is our lung nurse navigator at Richmond University Medical Center. Through RUMC Connections, you'll meet the fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll also provide you with useful information about your own health, explore the latest medical news, and hopefully get you answers to some of your own health-related questions. So tobacco use. It is still the leading cause of preventable death and disease in the country and leads to 480,000 deaths in the United States each year from cigarette smoking alone. That's a pretty staggering number considering all that we know in this day and age about smoking. While cigarettes cause the most deaths from cancer, respiratory, and vascular disease, they are not the only tobacco product linked to adverse health outcomes. Using smokeless tobacco is also a known cause of cancer, and the rise of new tobacco products like e-cigarettes, heated tobacco products, and products containing synthetic or non-tobacco derived nicotine present emerging health risks. All year long, Nancy is our superhero, and she promotes awareness of the risks of using tobacco products as well as the importance of lung screenings for those at high risk of COPD or lung cancer. And Nancy Sayegh-Rooney has been a RN for over 44 years. She has worked in various areas of nursing from the beginning of her career, from the emergency room at Methodist Hospital in Brooklyn to endoscopy at RUMC for over 25 years. Nancy has been a certified oncology nurse navigator for the past 10 years in RUMC's lung screening program. Screening for lung cancer helps save lives with early detection, and Nancy received her certification as a tobacco specialist from Rutgers University. She's an active member in the Staten Island community, currently working with other community members on educating the danger of vaping to the children and bringing awareness to their parents. So, as we know, the battle against cigarettes or any nicotine product remains a pivotal challenge. Many people make several attempts before finally going nicotine-free for good. And we know that a lot of people smoke. What are some of the reasons that you think people smoke, and why is smoking such a difficult thing to stop?
It's an addiction. Well, first I'd like to thank you for inviting me because this is a very, very dear to my heart, and I'm very passionate about this because it is preventable. Mm-hmm. And yes, when you talk about 400,000 people, you're talking about 4 stadiums, baseball stadiums or football stadiums of people that are dying from smoking, mm-hmm. just lung cancer from smoking. And half of that is secondhand smoke lung cancer.
Wow.
Okay, so about 200,000 die each year from secondhand exposure. Your question is, why are people still smoking? Because it's an addiction. It's not a habit. Yeah. And the big tobacco companies knew about the addiction, and the addiction starts with the first puff. So when most of my patients mm-hmm. and my lung screeners start at the age of 50, and if you ask them when did they started in their teens. Wow. Most of them started 12, 14, 16 years old. Mm-hmm. So what happens is, if you think about it, that's when the brain is still developing because the human brain doesn't fully develop till 25. So when they have that first puff, whether it's in the schoolyard or in the school bathroom with their friend and it's peer pressure, that delivery of nicotine reaches the brain today in 9 seconds. It's the fastest delivery of a drug. But back in the day when my parents and the population was smoking, mm-hmm. the delivery of the drug was 11 seconds. So what changed? Well, I'm going to tell you what changed. The tobacco companies started coating the leaves with ammonia so it burns faster. So the faster you get the nicotine to the brain, the release of dopamine and that good feeling comes along, and the addiction starts right then and there, okay? Using products, and there's over 7,000 products that are in the preservative of tobacco.
7,000?
7,000.
That's a staggering number.
But there's 70 of them that we know are carcinogens, okay? They're not just smoking tobacco leaves.
No.
There's chemicals in there. One of the other chemicals that is in there is acetone, okay? I can only purchase so many chemicals. The other chemical that helps preserve it is mothballs.
No way.
Yeah, because otherwise it would get moldy.
Wow.
Right?
Yeah.
So one of my clients used to smoke 2.5 packs a day, and as I do the tobacco classes, we do a 6-week course, and it's knowledge is power. By educating people why they're smoking, giving them the information of how it really happened.
Yeah.
And yes, they do try. It takes about 8 to 30 quit attempts for a smoker to finally quit.
8 to 30.
Right. So remember, they all started with one cigarette, and they move up to a pack, and I'll explain to you how that happens. But so let me get back to the mothballs.
Yeah.
So acetone, mothballs, but I used to carry mothballs with me, but the smell was just too much for my car. So this one client came in, and week 1 we do a lot of education, and we do round table. And week 2 we're doing more education. By week 3, I put the products on the table, and we're asking everybody, and I'm explaining to them what's in these products and why I put them out. And week 4, this particular client comes in, and I said, how are you doing? And she was a 2.5 pack a day.
Yeah.
And she says, well, I'm down to a pack a day. And I said, really? That's amazing. How did that happen?
Yeah.
She says, all I could think about was the mothballs. And today she's over 5 years of smoke-free because that aha moment she had thinking about mothballs in her mouth was the reason that it clicked. It finally clicked. So that's why it takes so many attempts for them to finally quit. When these young boys or young girls start, that first puff gives them that feeling, and the brain, it goes to a part of the brain called your memory receptor.
Yeah.
Like when you go to church or you hear a lullaby that you haven't heard or a song on the radio.
Comes back
but
to
you
you.
know those words. And the tobacco companies knew that. So it goes to that part. It's sort of like a fossil imprint, and you remember it. Now, back in my 20s, back in the 80s, everybody smoked. It was socially acceptable to smoke.
Of course.
And even I was a smoker back then. And today, if somebody is passing by with a cigarette that's a parliament, I know it's a parliament because it's
That memory.
It's in that memory.
Wow.
Okay? So, but the tobacco companies knew about this.
Yeah.
So what can we do to help people? Okay? So first of all, you have to offer them the opportunity.
Okay.
And nobody wants to be told you got to quit. No. Like nobody wants to be told you got to lose weight. That doesn't work. No. So we have to change our verbiage of what we're asking people. So when I first took on this role as a lung screener, all of my patients were smokers. So I needed to educate myself about tobacco. So that's why I went to Rutgers and took an intense course and became certified. And we all think we know everything. I knew nothing.
Wow.
I mean, the science behind smoking is just incredible. So you may say to yourself, okay, so you have one cigarette. How does it get to 20 cigarettes? How do people get to a pack a day? Well, that one cigarette takes about 5 minutes to smoke, right?
Okay. Yeah.
Somebody has that first cigarette, okay? And, you think about those young children, and they may cough their first time, but a lot of times they get that delivery of the nicotine to the brain.
Okay.
So they have that first cigarette. So for every one cigarette, it's equivalent to 1 milligram of nicotine.
Yeah.
Okay? So that nicotine, that 1 milligram is floating around, they feel good, they're okay, and then within an hour, it has a half-life. They only have a 0.5 milligram floating around. And then within 2 hours,
It's gone.
they don't have any nicotine floating around. So that's why you see outside of any business or any corporation, and you always see that crowd outside together smoking.
Yeah.
And you think that they're, why are they always out there together? Okay? Well, they don't beep each other. They don't call each other. They're not texting each other. They're all on the same withdrawal pattern. So I work in a hospital setting. So the 7 o'clock employees that are smoking probably had their last cigarette at 6:45. By 8:45, they have no more nicotine floating in their body, and they're starting to get the jitters because as it leaves, you start to have a withdrawal, an actual withdrawal, and they want another. The brain is calling for another cigarette. And that's why they're all out there. So the 7 o'clock people are out there at 9. The 8 o'clock people are out there at 10. So like every 2 hours, they're all out there together.
Yeah.
And it blows your mind.
And is that, you think, what brings them to the pack a day, is that they're just constantly chasing?
So what happens is, remember, how many cigarettes are in a pack?
I'm not sure.
Okay. So there's 20 cigarettes
20,
in
okay.
a pack. So who put 20 cigarettes in a pack?
Yeah.
The tobacco companies knew the science.
Okay.
They knew this. So if you get up at like 5:30, 6 o'clock in the morning, you have your first cigarette within 10, 15 minutes, okay? And then by the end of the day, so you're spiking back and forth. You'll have somewhere between 18 to 20 cigarettes. They knew the science.
A convenient amount for one day.
Right. So then what happens in 1998, there was a big master settlement, the lawsuit, against the tobacco companies because there was a whistleblower that came out and said, they're not being honest with you. They knew what they were putting into these cigarettes. They knew the science. So there's 20 cigarettes in a pack. It's not 22. It's not 16. Okay, so they knew and they wanted everybody hooked on a pack. Okay, so now you got all these people in 1998 who are suing the tobacco companies.
Yeah.
Okay? There's this the states are suing, and because all of their constituents are now sick and dying, and family members were able to sue as well. So now there was this master settlement, and it was $25 billion over the next 25 to 30 years to the states that put in for the settlement. That's who fund your quit lines. Isn't that like an oxymoron?
That is.
They're funding the quit line because they had to do education. Okay, so that's what funds your quit lines to give you your patches and whatnot.
Yeah.
So that's why the patch works. The patch is pure nicotine. Nicotine does not cause the cancer. It does not cause the COPD. It doesn't cause the heart disease or the erectile dysfunction or the infertility. It causes the addiction. So the addiction starts with that first puff, okay? How do we stop the addiction?
Yeah.
Is by, if they started with that one cigarette, they need to come down, okay? So some of my patients will say, well, I just stopped cold turkey. They're going to have a relapse. If you stop cold turkey, some people may never smoke again, but most of the times they'll have a relapse when a stressful situation comes and they'll reach for that. And then it starts again with that one cigarette, and then it goes right back to a pack a day.
Yeah.
Okay? So that's where the patch comes in, and I'm a firm advocate for the patch.
Okay, so you think that's the most effective?
That's the most effective because we know it works. It's the only evidence-based product that works. So it's actual pure nicotine that gets absorbed over the course of the day.
Okay.
And then we start with the 21 milligram patch. And
So there are various amounts of nicotine.
Right. So if
in
you
each
smoke
patch.
a half a pack, and you have to really get the information from the patient
Yeah.
or the client, how much they have to be honest with you. So what happens is you do and why, you may say to yourself, why 21 when you said it was 20? Because the way that a person drags may pull in more milligrams. Okay. So now you have someone smoking a pack a day, you put a patch on, But there's two parts of the brain that smoking affects.
Yeah.
So there's the physical addiction, and then there's the psychological addiction. This is their best friend. Yeah. This is who they spend most of their time with. So what are we going to put here? And so that's where I'm very successful in using cinnamon sticks.
Oh.
Because a cinnamon stick you have to get the right one.
Yeah,
because they're
but
all
it's
different
similar.
sizes. But it's the similar diameter. It has a hole in it, and they can put it in their mouth, and no one's going to tell them, don't do that.
Yeah, it's
Okay?
cinnamon. And it has a nice fragrance. And
Right, but they don't smell it.
Okay.
Okay, so you may ask me, why don't they smell it?
Yeah.
Okay, so if you've ever stood near a smoker and you know they smoke,
Yeah.
why do you know they smoke?
Because they smell.
Because they have that's called third-hand smoke. So there's first-hand smoke is what they inhale.
Okay.
Second-hand smoke is the cloud. Third-hand smoke is what's
stays
on them.
Wow.
Okay, and that's toxic to children, to pets, because that falls down onto your carpet. The kids are on the carpet. The dogs, the cats, they're on the carpet. So that's...
And that impacts people.
Yes, impacts your pets. Wow. That's why dogs and cats get lung cancer.
That's very interesting.
Okay?
I never knew that.
So if you've ever gone into a smoker's house,
Yeah.
you can see the tar
The film almost on the wall. Yeah.
on the walls, okay? So a patient will say to me, well, I only smoke in my kitchen. I go, well, that's not really good because now you're not only smoking it, you're eating it. They go, what are you talking about? I go, because the residue of that third-hand smoke is now on your coffee cups, it's on your utensils, it's on your pots, so now you're eating it. And they're like, oh. I go, yeah, you need to smoke outside. So now why do they smell and they don't smell it? Again, it's the science. The actual smoke, not the nicotine, the smoke causes, we have little hairs in our nose.
Yeah.
Well, those hairs are like
Receptors.
broomsticks.
Yeah.
They're broomsticks so that they filter out all the debris that we don't want to inhale into our lungs. That's why we sneeze. That's why we cough.
Yep.
So a smoker, those little hairs are called cilia. And those little hairs, when you're smoking, get paralyzed.
Okay.
And they're not doing what they're supposed to do. Okay? They're not filtering anything out, and they're not, the sensory of smell is no longer there. So now I had an employee come to me once, and, everybody knows what I do in the hospital, and if they're the smokers that go out, they see me, they go...
They run away.
Here she comes. But this particular employee would come up to me, I'd say, listen, I don't want you to quit. Yes, that is our ultimate goal, but I want you to come in and get screened. Let's do that first. And when I speak to family members, I'll tell them that too. Let your parent or your loved one come in for a screening, and then we can talk about tobacco. And like I was saying before, we have to change the verbiage. We can't say to them, you got to quit. We have to ask them, can we talk about your smoking or your tobacco or your nicotine habits? And then they'll open up.
Okay.
And because you're giving them permission.
You're not telling them to do something.
You're not telling them. And 99% of the patients or the clients that I deal with will say, yeah, I've tried. And, do you have any suggestions? There's only that 1% that'll say, nah, I'm just here for my lung screening. I'm here because my wife told me to come. So now let's get back to my friend that comes in. And one day she comes to my office and she's standing there and she's panicked. And she says to me, okay, Nancy, I have to quit. I have to quit. I go, all right, let's just say her name is Susie. I go, Susie, what happened? What happened today that is bringing you to my office? She says, well, my daughter just told me she's going to have a baby, and I can't go near her or the baby unless I quit. And I said, well, I have to be honest with you. I can taste the smoke in my mouth right now. And she was about our distance.
Wow.
She's like, what are you talking about? I said, Linus from Charlie Brown? And there's that film around him. I go, that's what's around you, and it's in my mouth. A smoker is a different patient than any other patient, okay? Because of the stigma that lung cancer has with it, there's a different So if you go to the dentist, what do you do before you go to the dentist?
Brush your teeth.
Well, what do you think a smoker does? Because I just told you about third-hand smoke. What do you think they do before they go for their physical?
I would think they brush their teeth and maybe try not to smell like a cigarette, maybe change their
They
clothes.
take a shower,
Yeah.
they put perfume on. So when the doctor's doing his assessment
He's
and
not gonna
says,
detect
are
it.
are you smoking? Oh, no, I don't, because he's not
Yeah.
going to smell it. So now let's get back to the cilia. So the cilia's point is that they don't smell it, okay? And they can't smell it, and the tobacco companies knew this, right? So that's why when an ex-smoker smells smoke or smells somebody smoking, they're like, "Oh, that's disgusting. Did I smell like that?" Yes, you
She
did.
did, yeah.
You did. Okay.
You don't realize
And
it.
yeah, and especially when a grandparent or a parent is holding a child and they have little lungs and it's on their clothing, it's
sensitive.
toxic.
Yeah.
Now what happens when they start to cut back? That cilia wakes up, okay? And they start to smell and they start to taste. And that's why they gain some weight, because now food tastes good.
Better than,
Right.
because, yeah.
Yeah. So you can always lose a pound. You can't get a new set of lungs, right? So that's what we always try to encourage.
Of course. So I'm sure when the patients are quitting, you're encouraging the importance of the healthy lifestyle and diet and exercise and everything, so that
and
they can
I always tell
combat
them,
it.
you have to change what you were doing. So if you always had a cup of coffee and a cigarette in that same chair, you need to change that chair, okay? Have your coffee somewhere else. Why do you always see coffee?
Yeah.
Yeah, you
What
always
is it?
see it goes hand in hand, right? And you think, oh, what are they doing? Why are they always doing it together? Well, there's a science behind it.
Really?
There's always something there is a reason why that happens.
Okay.
So you and I are non-smokers. So we have a cup of coffee, we get caffeine.
Yeah.
We wake up and we move on. The smoke from the cigarette, not the nicotine, the smoke does not allow the absorption of caffeine into the body.
Really?
It blocks the absorption of caffeine. So they're always looking for that caffeine hit. So when I speak to a patient about putting a patch on and I get the proper milligrams on them, whether it's patch 1 or patch 2, I have to ask them their caffeine history. And how many cups of coffee or tea do they smoke? Because they'll put a patch on, still drink their 5 cups, get the jitters, and think it's from the patch. It's
But
not
it's
the
the
patch.
caffeine
It's
actually
the caffeine.
getting into the system
They're
now.
actually they're absorbing the caffeine.
Okay. Wow, I never knew that.
No, not a lot of, that's new science.
Yeah.
But that's something people have to realize, because so many times the patient will put on the patch and say, it gave me the jitters. I'm like, no, the patch didn't give you the jitters. It's what you were drinking gave you the jitters.
And how long do people need to stay on the patch before they're fully able to?
Well, we try to do we do steps. It's step 1, 2, and 3. So we'll do the 21 milligram patch for anywhere from 4 to 8 weeks.
Okay.
So and we have to do the dual. We have to give them something to do with their hands. And I also do a worry stone, because they got to keep their fingers busy. We also do what we call the 5 Ds,
Okay.
which is delay the feeling of drink water, do some deep breathing. And I don't mean just doing, I mean doing like
meditation.
doing a quiet breathe. It only takes 3 seconds to close your eyes and take a deep breath. That's why when people say just breathe, that's what they're talking about. Just get some oxygen into your oil cells. Drink water. If they drink water before they pick up a cigarette, it'll delay the craving, because the craving only lasts for 2 minutes.
Oh, that's it?
Yeah. So if they can extend the time between each cigarette, then by the end of the day, they'll have 1 less cigarette.
Okay.
Okay.
So if they smoke a cigarette while they're on the patch, will it make them feel sick or anything? No.
No, there are days that they went out and smoked more than a pack.
With the patch
So
on.
what I explain to them is, if you have the patch on, do not take the patch off, because the patch is a release. It's a slow release throughout the day.
Yeah.
Leave the patch on, put the cigarette out. Okay? Because remember, this was their response.
the habit
Okay? To put it in their hand, this is their best friend. And also, So we'll do the patch 1, which is 21 milligrams, for 4 to 8 weeks. And then we can go to step 2, which is 14 milligrams, which is equivalent to like a half a pack.
Yeah.
And by then, you're changing some of their behavior.
Okay.
But it has to come from here and here. They have to want to do it. And when they get to that point, they're done. And when you explain to them this knowledge and you give them all this education about, you didn't do this, the tobacco companies did this. They knew what they were doing, because it's all about greed. And if you look at the numbers and say to them, listen, you could save, like today in New York City, it's $15 a pack.
Wow.
So that's close to like $5,000 a year.
Easily.
What you could buy, what you could do, and how it's robbing you financially, and it's robbing you of your life.
Of course.
Okay, because they can't once that COPD happens and they get to that point,
You can't reverse it.
they can't reverse it. You can get a little bit better,
But that damage is done.
the damage is done.
Yeah.
So what actually happens is the oxygen is being replaced with the not carbon monoxide, but that's what they're inhaling. They're really inhaling. A cigarette is just like a tailpipe.
Yeah.
Okay? But their CO2 levels in their body is higher. So I always tell a patient before we quit, like when they come in to the, and we do our group, I go, okay, everybody take a selfie, okay? And they're like, why? I go, because you'll understand once you quit, and you'll see the difference in your skin tone, because the skin is the furthest place away from your heart.
Okay.
They look ashen. They look like an ashtray, don't they? A heavy smoker.
They do. Their skin,
right. But once they quit, and the skin gets the oxygen, and it happens very quickly, and they start to smell and taste. It happens, within hours of them, the body starts to repair itself, and they get pink. And then you'll often see somebody and say, wow, your eyes, I never knew they were blue. Because now they're reflecting off of the pinkness. And so then it really does make a difference.
It does.
So then we go down the steps, and then it works. It does work.
Now, how frequently is it a group, or are you meeting with individuals?
Well, I do individually. I do with each one of the lung screeners that come in, and if anybody calls, I'll do it. Because of COVID, we had stopped the groups.
Yeah.
And now we do it once a year. We were doing it twice a year.
Okay.
But there's just not enough time in the day.
Yeah.
And so we'll do it again in the fall, and it'll end right before Lung Cancer Awareness Month.
Okay.
Okay. So I do have an idea of why we do it, because we want to bring awareness to the lung cancer. Everybody knows about breast cancer,
Of course.
but lung cancer is the number one killer of women. Okay, and that's so I partner with Lung Force for the American Lung, which is the movement to get it on women's radar. Okay, like if you recall Donna Summers.
Yes.
Not everybody knows her, but when I speak to these younger nurses, they're like, who? I go, look her up and you'll find her. Okay. So Donna Summers and Christopher Reed's wife were not smokers, but they were both singers in lounges back in the day.
So they were inhaling it secondhand.
Smoke, and they died of lung cancer.
Wow.
So it's real.
It is real.
It's real.
And we have a few minutes remaining, but before we have to wrap things up, I mean, what do you think now about all of the vaping and how that whole...
Well, the vaping is... Well, think about my generation and your generation. We were always told... We were all anti-smoking. So who was losing money? Big tobacco. Yeah. So who's backing these vapes?
Oh, big tobacco.
Big tobacco, okay? So and they're not FDA regulated. So right before COVID, the American Lung and all the lung corporation, all of the lung associations and whatnot, were almost there to get it FDA regulated, because we need to know what's in those products, because nothing goes in your lungs but oxygen. Nothing. Whether it's, people say cannabis. We at RUMC have had multiple patients with just cannabis smoking with lung cancer. So nothing goes in your lungs but oxygen. So when these kids are going to these vape shops and they're getting this juice, you don't know what's in it. we know that there is, we know that there's benzoic acid in there. We know there's polyurethane in there. None of that should be in your lungs.
No.
And right in August of 19, I don't know if you remember this, but there were 6 young boys that died from respiratory arrest or respiratory, an event from vaping. And so from that, there is a new diagnosis called EVAL, which is electronic vaping acute lung injury. So when people are asking, that in the hospital setting, are you a smoker? We also have to ask, are you vaping? So yes, it's doing lung damage. Are we going to see the damage the same way we see it with smoking? We may see it sooner, okay? But it's not FDA regulated. We don't know everything in those products. And once those products are regulated and they're taxed the way cigarettes are, because they're not, then what's going to happen to the price?
Oh, it's going to skyrocket.
It's going to skyrocket. What are the kids going to smoke? They're addicted to nicotine. They're going to go back to cigarettes.
Because
so it's
too
a back door for the tobacco companies
to get back in
to
there.
get back in there.
Okay.
So it's really sad. It is the hardest addiction to overcome. I mean, a lot of my clients will say, I've been addicted to this, this, and this, but this is the hardest one. And it's because of everything that I told you about the brain, about the chemicals, But it can be done. People do it.
No, of course.
I'm here if they want, and I'm working with a group of women and the DOE, and we're going to be doing an assembly for high school students.
That's great.
To come and learn, and then go back to the younger students, because it is affecting these kids.
It is.
You can't put anything in your lungs other than the air you breathe.
Of course, and like you said, education is key. So that's very important initiative to be a part of for sure. And thank you once again for all that you do for our community.
You're welcome.
And for all of the information that you provided us with today. It was very interesting.
Anytime.
I learned a lot. And
If you go home with 3 things,
of course,
then I did my job.
You absolutely did.
You have to think about, you've been on New York City subway.
Yes.
And at one point in your life, someone told you don't touch the 3rd rail, right? But you don't know why you know that, but you know that knowledge. So we have to keep the conversation going and let them know, you do not touch this. This is the 3rd rail. It's going to kill you.
Yeah.
It's not going to kill you instantly, but it's going to kill you in the long run.
Over time, of
So
course.
knowledge is power. So the more we educate them, the better off we are.
That is so true. So if anybody would like additional information about the tobacco cessation program at RUMC, they can feel free to call 718-818-2391 or visit rumcsi.org. That about does it for this episode of RUMC Connections. I'm Meredith Gaskins.
Thank you. Thank you for having me.